Good evening, Pa.
Doc, of course, we want to talk about the president's response last night. That's top of head for a lot of people. Pero I suppose what's more important to talk about first would be, the College of Physicians wanted a stricter quarantine, at least for the next 2 weeks, to give some breathing room for the whole response network. Now we are under, at least in a few hours, we'll be under MECQ. Is that enough from your point of view? Would that be enough breathing room for the next 2 weeks?
We believe that it is quite enough because at least we really wanted a stricter community quarantine that will be implemented in the whole of the National Capital Region. So MECQ will be better than the general community quarantine that we have in place. No? So that's good enough. At least it's good enough for us to help, no, stop the spread of infection, and then most importantly, it is also good enough for the government to really step back and recalibrate, no, yung mga strategies that will help us really win the war against COVID-19.
By recalibration, in the meantime, Paul, give us an idea of what our frontliners and their institutions, so the hospitals, the doctors, the nurses, in the next 2 weeks, what can you do? What will you actually be doing over the next 2 weeks to make the most of this timeout?
Robbie, I don't think that we will be seeing really a dramatic decrease in the number of COVID-19 infections, no. But for our group, no, for the whole for the 100 medical organizations that are in place, no, who are supporting this call, I think we will be able to help the government, come up with more effective programs that will really be able to control the spread of this infection.
Doc, medyo na-confuse ang public dun sa question on effective nga ba talaga ang mga lockdown? We were already slowly moving toward the thought that lockdowns can only do so much. So we were kind of like thrown into a loop when your group asked for an ECQ. Over the long term, do you really think that quarantines help if the public solutions you're asking for are put in place?
We believe kasi yung nakita namin, no, observing from what has transpired the past few months when we moved from ECQ to MECQ and then now to GCQ. What we noticed was the change in the behavior of people. So I think the putting the NCR in a stricter or tighter community quarantine will give the message that the public must really follow the necessary measures in order to protect ourselves and also to prevent the spread of infection. In the other countries, no, they have when they were able to apply the community quarantine, the lockdowns, no, these are the countries that have shown to be able to successfully control the pandemic,
spread.
no, at the spread of the infection at an earlier time. So, yan, nakita natin yan sa Vietnam. And we see Vietnam, how they are doing right now, no? And that is exactly because they have immediately placed their country on lockdown. Tayo, and medyo kailangan talaga medyo patatagalin mo until such a time na na-control mo talaga ng maganda yung infection.
Kasi Doc, yun nga yung kinatatakutan. After August 18, pag nag-GCQ, balik na naman sa dating gawi. So parang paulit-ulit lang. How do we make sure that that's not gonna happen?
Yeah, so that's why we're talking with the Department of Health that included din dito is to make the public understand, no, that we need to continue the behavior of putting our mask on and also maintaining the physical distancing. Kasi 'di ba napansin ninyo no, through the weeks that have gone by, marami na mga tao na who are not really following, or if and when they are using their face mask, they're using it
Mali.
yeah, wrongly.
In the wrong way.
So
Yeah.
yeah, the wrong way, no? So instead of making sure that both the nose and the mouth are covered, no? So it has to be na covered parehas, no? Ay yung iba sa kanila you will see na it is
Yeah.
showing their nose, or probably they're
Yeah, Doc.
covering the chin.
Hmm.
Hindi naman yun ang tamang pamamaraan. So basically,
Yeah.
you are still promoting the spread of the infection.